Firstly, I'd like to introduce myself. My name is Laura Edwards. I'm the chair of the VCCN. Today, I am wanting to share with you a little dip into our abstract submissions for conference. And this is really there as a guide to help you navigate what it is we're asking for, and to really give you the reasons as to why you should do it at all. Please listen at your leisure, and if you've got any queries after you've watched this, our contact details are on the last slide. Thank you. First of all, why should you submit an abstract at all? Critical care veterinary nursing has taken a huge leap in the last 10 years. It's a growing speciality and has enabled RVNs who wanted to diversify their skill base. It's opened up the door for the veterinary profession to ask more of its nurses and shine a spotlight on just how much a registered veterinary nurse can enhance patient care, improve quality of practice, and become an educational mentor in ways which they have never done before. The reasons for VCCN's existence is down to the committee members themselves. All of us are registered veterinary nurses with a varied background in practice, but all with one thing in common. We want critical care veterinary nursing to take the next step towards enhancing the profile of RVNs in the wider community. We're striving for cooperative education with our human critical care nurses and trying to create a learning and sharing platform like there is no other. We're only able to do this with you and your colleagues joining us on this journey. We want to help more RVNs into research, both small and large projects. We want to encourage those nurses who want more out of their profession to step up and share with us what they're involved in, teaching, learning, researching, and creating a group that we can all benefit from each other. Why are we different? What makes us stand apart? A number of things. Firstly, the VCCN is a region under the BACCM, which means we're governed by a non-profit charity who's been established for 37 years already. The BACCN are a human critical care nursing association who are involved in the education, research, and empowering critical care nurses within the human medicine field to grow, diversify, and shout from the rooftops about their speciality and just what it means for the wider public and, in fact, the world of nursing. The BACCN collaborate worldwide and have a membership base of over 2,000 critical care nurses. They've created 12 regions around the UK, with the VCCN being the 13th and the newest region. The next conference in Belfast 2022 includes a massive 6 streams, including simulation training. One of these streams is us. We have an incredible opportunity to present a snapshot of the skills, knowledge, and research happening in the world of veterinary medicine being led by registered veterinary nurses. Delegates will be able to attend any of the talks, workshops, simulations that they want during conference. How often do you get a mixture of veterinary and human nursing education in one place? Both specialities have a huge amount in common, and sharing our knowledge will only enhance our patient care and drive education and awareness of the work of RVNs. Honestly, what have you got to lose? Sure, submitting an abstract does require some work on your behalf. However, we at the BACCN and the VCCN are encouraging your success at getting your abstract accepted. There are a number of options that can happen, and not all submissions will be suited to an educational presentation. Maybe your work's more suited to a workshop, or if you don't like talking to a room full of people, a poster presentation. Maybe you're finished or about to finish a research project from your degree or your master's qualification. In that case, you've done the hard work already. You just need to tell us about it. We're wanting to guide you, not judge you. Not everyone has experience of writing anything like this, and so we're creating this guide to help you. We may also send you your submission back, but with some guidelines and encouragement of how to get it accepted. If we like it, but it's not suited to this year's topic, then we may ask you to bank it for the following year. Your engagement in this project is what we are really looking for. Great, so you've decided to give it a go and submit an abstract. What next? Using the following slides, I'm going to guide you through the decisions that you need to make about your abstract and ultimately help you to see what your final piece is going to look like. The following presentation describes the 4 types of abstract that we are looking for. They include primary research, case studies, clinical education, and literature reviews. Feel free to skip through to the section you are interested in, or stay with me and let me help you decide. Primary research abstract. 300 words, excluding your title and your references. We must have a title, but it can be no more than 10 words. Your background. This should be the shortest part of your abstract. Tell us what gap in the research have you recognised? What problem are you trying to answer? Your aim? What are the questions you're trying to answer? This must be a clear research question. Method and design. These are different from one another. The design needs to be details of what guidelines did you use for your research. A link to the guidelines is sufficient. The method is details of how you analysed your data. What was your timeline and did you have ethical approval? Your results? Please summarise your key findings. We don't want tables or figures in your abstract. That will be for the final presentation. Your word count won't allow for it anyway, for this kind of detail at this stage. Implications for practice. This is not a repeat of your results. What I want to know is, why does this research matter? Why should it affect a nurse in practice? Do you have any recommendations for future research? It's worth noting if this research project is going to be ready for October 2022. If you don't have results yet and you will need to give us some assurances of your timeline, it may be we ask you to resubmit for next year if the research is not quite ready for Conference 2022. Our second type of abstract is either a clinical vignette or a case report. Again, 300 words. That does not include your title, your learning outcomes, or your references. These will be extra on top. Your title, again, no more than 10 words. Introduction. What is the case context and why is it relevant or important? Your case description. Think about your patient's journey. It could be positive or it could be negative. Describe a history, a physical exam, investigations, and then the outcome. Discussion. Provide a critical review of that case. What went well? What could be improved? Can this be supported with evidence-based literature? Include some quotes. If there's no evidence, say so. Does the evidence contradict your analysis? Implications for practice. Does this case show the need for further education or further research? What recommendations do you have? Learning objectives. You must identify 3 learning outcomes. Examples of this are, what can we do in this case? What can we treat? How can these cases be managed? How will this talk enable your audience to learn? Learning objectives need to use words such as recognise, assess, diagnose, treat, and manage. Action words that will show the benefit to your listeners. Our third abstract is clinical education. 300 words, excluding your title, your references, and your CV. Firstly, you're going to need to decide if your educational offering is best presented in a seminar format or a workshop. A seminar will include a presentation with perhaps some discussion time at the end. A workshop will be an interactive thing with some demonstrations, quizzes, perhaps some simulation. We want your title, again, no more than 10 words. Your introduction. I want you to briefly tell us your focus. For example, is it ECG recognition? Is it fluid management? Is it DKAs? The list is endless. Learning objectives. Why is this important to your listeners? Make these specific and measurable. For example, by the end of this session, my learners will be able to recognize the signs of hypovolemic shock and which fluid is appropriate. What is your aim for this presentation or workshop? For example, my aim is to provide up-to-date evidence on the fluid choices for hypovolemic shock management. Teaching methods. How will you deliver this session? Will it be PowerPoint or will it be a workshop? Audience participation. Will there be a 10-minute questions and answers session or a discussion at the end? How will you encourage participation? What planned activities do you have if you're creating a workshop? Target level. Is this clinical education targeted at beginners, intermediate, or advanced nurses? And then at the end, you must include your CV of the main presenter only. Our fourth and final abstract choice is a literature review. Perhaps you've been involved in some veterinary nursing journal clubs. There may be something of interest there. Again, 300 words, excluding your title and your references. Your title must be no more than 10 words. The aim of your literature review, you're going to state the question you're trying to answer. Background. Again, short. Why do you want to do this literature review? Design and methods are similar to the primary research abstract, so go have a look back at that slide. Include your research question. What method does the literature use to analyze its data? How did they back up their evidence? Findings. Outline the key findings and themes from your review of the literature. Implications for practice. How will your findings from this literature change your or others' practice? Will it have implications on standard operating procedures? What are your recommendations for future research? The reason our abstract submission process is so thorough is that we look to get our abstracts published in the BACCN journal after each conference. This is an excellent opportunity for you to get a piece of work published and allows you the opportunity to explore further avenues with other journals. However, this means the abstracts need to be of a publishable quality and therefore require referencing and formatted in a measured way. We're here to help you through and would ask you to speak with us to alleviate your fears or perhaps ask for some advice. We'd much rather help you through it than you not submit anything at all. The process is one of the ways in which we can lift the profile of a registered veterinary nurse and showcase the incredible quality of nursing happening right now. Nothing great was ever easy. Have you looked at the theme for 2022? It's breaking down the barriers. It's a continued theme from last year. The VCCN stream is in itself breaking down the barriers between our two professions, and therefore anything you want to discuss covering both emergency and critical care veterinary nursing will suit our conference theme. The decisions that you need to make are: what type of abstract do you want to submit? And we have 4 examples in the previous slides. Your word count of 300 is absolute. You will be unable to submit more than that in the application process. Please check your spelling and your grammar. That is really important. References are essential and need to be written in the Harvard style. It's a maximum of 3, so the main ones will do. We do not need reams and reams of references. These abstracts are blind reviewed, so no details of yourself should be included within the content of the abstracts themselves. Please allow plenty of time to do and create your abstract. Create perhaps a Word document and then cut and paste into the abstract submission. This will allow you to review your submission in an easier format. I would like to take this opportunity to thank you for watching this presentation, and I truly hope it's given you some ideas about what you want to offer. This really is a unique opportunity to get involved in an educational experience like no other. I hope that this presentation has helped answer some of your questions and alleviate some of your fears. But if it hasn't, please don't hesitate to contact either myself, Laura Edwards, or Lindsay Ashburner on the email you can see on the slide. We're really looking forward to hearing from you and are even more excited to see what you have to present. Thank you again.